7,000 years ago, somewhere in a windswept valley in what is now France, a man lay down on the cold earth. Someone knelt beside him holding a sharpened stone. Then, without anesthesia, without antiseptic, without any guarantee he would live through the next hour, that stone was pressed against his skull, and they began to cut. He survived. We know this because his bones told us so. There is a moment in human history when we stopped simply enduring pain, sickness, and injury, and started fighting back. Not with medicine, not yet, but with something far more radical: the decision to open the human body on purpose, to heal it. Today, surgery is precise. It is sterile. It is guided by anesthesia, imaging, and centuries of accumulated knowledge. A surgeon can stop a heart and restart it, but strip all of that away. Go back past the hospitals, past the scalpels, past the written word itself, and you arrive at something almost impossible to imagine. A Stone Age human, armed with nothing but flint and courage, cutting into another person's skull, and that person living to walk away. This is the story of how that happened. How a species with no understanding of infection, no concept of anatomy, and no way to dull pain, still found the will to operate. And how, step by brutal step, across 10,000 years, that first desperate act of survival surgery evolved into the operating rooms we trust with our lives today. Some of what you are about to see will be hard to watch. All of it actually happened. This is the history of the first recorded surgery, and everything that came after it. The skull that shouldn't have healed. In 1685, a Swiss anatomist was examining a prehistoric skull unearthed near the town of Ensisheim when he noticed something strange. A hole, roughly circular, cut cleanly through the bone. His first assumption was violence, a weapon, a war wound, a fatal blow. He was wrong. The edges of the hole were smooth, rounded, healed. This was not a wound that killed someone. This was a wound that someone survived, and not for a few days, but for years afterward. The bone had regrown around the opening, slowly closing in on itself the way bone does when a body keeps living, keeps repairing, keeps fighting. What that anatomist had found, without fully understanding it yet, was evidence of trepanation, the deliberate act of cutting or scraping a hole into the human skull. And it wasn't an isolated case. As archaeologists kept digging across Europe, across Africa, across the Americas, they kept finding more. Skulls from 6, 7, even 10,000 years ago, all bearing the same unmistakable signature. A hole, cut by human hands, cut on purpose. This is widely considered the oldest surgical procedure in human history, older than writing, older than agriculture in some regions, older than the wheel, which raises the question that should stop you cold. Why would a Stone Age human, with no knowledge of the brain, no understanding of infection, and no anesthesia of any kind, deliberately cut a hole into another person's head? The answer is more human than you might expect, and far more disturbing. Picture the world these people lived in. No germ theory, no concept that invisible organisms could cause disease. When someone suffered violent headaches, seizures, or lost consciousness after a blow to the head, there was no explanation rooted in biology. There was only fear and belief. Many anthropologists believe trepanation was performed to release what these early communities understood as evil spirits, trapped pressure, or malevolent forces they believed were causing the person's suffering. Others suggest a more practical origin. Some of the skulls show trepanation performed near actual injuries, fractures, and bleeding, suggesting that some healers had begun to notice, empirically, that removing pressure from a damaged skull sometimes helped. Either way, the method was the same, and it was brutal. Using flint blades, obsidian tools, or even shark teeth in coastal regions, a healer would scrape, cut, or drill through skin, muscle, and bone, sometimes taking hours to complete a single procedure. There was no anesthesia. There may have been pressure applied to nerves, herbal preparations with sedative properties, or simply the assistance of several people holding the patient still. Now here is the detail that changes everything we thought we knew about prehistoric medicine. Archaeologists studying these skulls developed a way to determine survival. Fresh, unhealed cuts meant the patient died during or shortly after the procedure. But bone that had begun to smooth and regrow around the opening meant something remarkable. The patient lived. In some sites, survival rates were estimated at over 50%. In certain regions and time periods, closer to 70 or 80%. Let that sink in. 10,000 years ago, with stone tools and no medical theory whatsoever, more than half the people who underwent this operation survived it. Some skulls show evidence of multiple trepanations performed on the same person at different points in their life, each one healed before the next was made. One skull, discovered in Peru, shows 7 separate healed openings. 7 times, this person went under the stone blade. 7 times, they walked away. This wasn't reckless violence. This was medicine, in its rawest, earliest form, developed independently by cultures with no contact with one another, on nearly every continent on Earth. Trepanation has been found in Neolithic Europe, ancient China, pre-Columbian Peru, and Polynesia. Different peoples, different eras, arriving at the same terrifying, courageous solution. But trepanation was a practice passed down through observation and oral tradition. It left no instructions, no explanations, no record of why or how beyond the bones themselves. To find the first surgery ever written down, deliberately recorded for others to learn from, we have to leave the world of bones and travel to a civilization obsessed with permanence. We have to go to Egypt, the papyrus that changed medicine. In 1862, an American collector named Edwin Smith purchased an ancient scroll in Luxor, Egypt. It would take decades before anyone understood what they were holding. The document, now known as the Edwin Smith Papyrus, dates back to roughly 1600 BCE, though scholars believe it is a copy of a much older text, possibly composed as early as 3000 BCE. It is written in hieratic script, the everyday writing system of ancient Egypt, and unlike most Egyptian medical texts, which lean heavily on magic and incantation, this document reads almost unnervingly like a modern clinical manual. 48 case studies, each one structured the same way: a description of the injury, an examination, a diagnosis, a treatment plan, or in the most severe cases, a chillingly honest admission that nothing could be done. This is, as far as historians can tell, the oldest known surgical text in the world. The cases inside are almost entirely trauma injuries, the kind a physician attached to a construction crew or a military unit would have encountered constantly. Skull fractures, spinal injuries, broken noses, dislocated jaws. The author describes how to examine a wound by touch and sight, how to test for nerve damage by checking whether a patient can move their limbs, and how to close wounds using sutures. A technique described here for the first time in written history. One case describes a patient with a serious skull injury. The physician is instructed to examine the wound, and if he finds the brain itself pulsing beneath a fracture, visible testimony that ancient Egyptian physicians understood the brain was connected to bodily function, he is told plainly that this is a condition for which nothing can be done. Not out of ignorance, but out of honest, evidence-based diagnosis. This detail matters more than it might seem. It tells us that Egyptian physicians were not simply performing rituals and hoping for divine intervention. They were observing, documenting, building a body of practical knowledge meant to be passed on, tested, and refined by others. They understood swelling. They understood infection, even without knowing its cause, describing wounds that turned foul and advising against operating on them. They developed early antiseptic-like treatments using honey, known now to have genuine antibacterial properties, and moldy bread, which modern scientists have found can contain natural antibiotic compounds centuries before anyone understood what an antibiotic was. This was surgery becoming a discipline. Not a desperate act of survival passed down through instinct, but a system, written, testable, teachable. And once knowledge could be written down, it could travel, it could grow. The next great leap wouldn't come from Egypt, but from a civilization half a world away, one that would push surgical skill further than anyone had dared before. The surgeon who rebuilt faces. In ancient India, sometime around 600 BCE, a physician named Sushruta compiled a text that would later be called the Sushruta Samhita, a work so advanced in its surgical detail that modern historians still study it for insight into the origins of plastic surgery. Sushruta's world was violent in a specific, brutal way. Under certain punishments of the era, criminals and prisoners of war sometimes had their noses amputated, a mutilation meant to humiliate and mark someone for life. Sushruta responded with something extraordinary. He developed a surgical technique to rebuild the nose entirely. Using a flap of skin cut carefully from the patient's own forehead, still attached at one end to preserve its blood supply, he would shape and graft new tissue onto the wound, reconstructing a nose where one had been taken. This procedure, now known as the forehead flap technique, is still used by plastic surgeons today, nearly 26 centuries later, almost unchanged in its basic principle. The Sushruta Samhita doesn't stop there. It describes over 300 surgical procedures and more than 100 surgical instruments, scalpels, forceps, catheters, needles, many designed with a level of specificity that suggests years, possibly generations, of trial, failure, and refinement. Sushruta also described cataract surgery, using a curved needle to carefully displace the clouded lens of the eye, restoring sight to patients who had lived in darkness for years. He wrote about cesarean deliveries, about setting fractures, about draining abscesses, and, remarkably, about the importance of hygiene and cleanliness before operating, insisting that instruments be properly prepared and that the surgical space be kept clean over 2,000 years before germ theory would explain exactly why that mattered. He also insisted that surgeons practice their technique before ever touching a real patient, using vegetables, dead animals, and even leather bags filled with water to simulate the resistance and texture of human tissue. In doing so, Sushruta may have created the earliest known form of surgical training simulation, a practice hospitals still use today, just with far more advanced materials. What emerges from India in this era is not a single dramatic breakthrough, but something arguably more important: the idea that surgery could be a rigorous, teachable science, refined through deliberate practice rather than desperate improvisation. While these advances unfolded in India, another civilization on the shores of the Mediterranean was developing its own philosophy of the body, one that would come to dominate Western medicine for the next 2,000 years. Around the 5th century BCE, on the Greek island of Kos, a physician named Hippocrates began teaching an idea that, on the surface, sounds almost obvious today, but at the time was nothing short of revolutionary. Disease was not a punishment from the gods. Illness, Hippocrates and his followers argued, had natural physical causes. It could be observed, studied, and treated using reason rather than superstition. This single shift in thinking pulled medicine away from the temple and towards something resembling science. Hippocratic physicians practiced limited surgery, mostly setting fractures, draining fluid from the chest in cases of severe illness, and treating wounds. But their most lasting contribution wasn't a technique. It was a standard. The Hippocratic Corpus, a collection of medical writings attributed to Hippocrates and his school, laid out expectations for how a physician should behave, including the now famous principle often summarized as, "First, do no harm." For the first time in the historical record, surgery and medicine were being bound not just by skill, but by a code of conduct. A physician wasn't simply someone who knew how to cut. They were someone bound by an obligation to their patient. This philosophy traveled with Greek culture as it expanded, eventually reaching the great library and medical schools of Alexandria in Egypt, where physicians in the 3rd century BCE began doing something almost unthinkable for the era: dissecting human bodies for the purpose of study. Herophilus of Chalcedon, working in Alexandria, is credited with performing systematic human dissections, mapping the nervous system, distinguishing arteries from veins, and studying the brain directly rather than relying on assumption. His contemporary, Erasistratus, went further still, exploring the heart's function, and even, according to some historical accounts, performing dissections on condemned criminals while they were still alive, a practice so ethically fraught that even ancient sources debated its morality. Alexandria's brief golden age of anatomical study didn't last. Political and religious pressures eventually curtailed human dissection across much of the ancient world for centuries to come. But the knowledge gained there, however it was obtained, laid a foundation. For the first time, physicians had a genuine, evidence-based map of what lay beneath the skin. That knowledge would soon be inherited, tested, and expanded by an empire built on conquest. And one man in particular would use the battlefield itself as his classroom. Rome did not invent surgery, but Rome perfected the conditions that forced it to improve. War, on a scale the ancient world had never seen. Roman military surgeons developed remarkably advanced field techniques out of sheer necessity. They used bronze and iron scalpels, forceps for extracting arrowheads, and even early versions of hemostatic clamps to control bleeding. Roman medical writer Celsus documented surgical procedures including the removal of bladder stones, hernia repair, and amputation, describing techniques with a level of anatomical precision that suggests direct practical experience. But the single most influential figure to emerge from Roman surgery wasn't a soldier or a statesman. He was a doctor to gladiators. In the 2nd century CE, a young physician named Galen was appointed physician to the gladiators in Pergamon, a city in modern-day Turkey. It was, in the grimmest possible sense, the perfect medical education. Gladiators suffered catastrophic, violent, and highly visible injuries. Torn muscles, shattered bones, deep puncture wounds, and Galen was there to treat every one of them. He later claimed that in his years treating gladiators, very few died from their wounds, a boast that, if true, speaks to genuinely advanced trauma care for the era. Galen studied musculature, tendons, and internal injuries not through theory, but through direct, repeated observation of the human body torn open in front of him. Galen went on to become one of the most influential medical writers in history, and his anatomical texts, based partly on human trauma cases and partly on the dissection of animals such as pigs and Barbary macaques, would dominate Western medical thinking for the next 1,300 years. There was a problem, though, and it was a serious one. Galen was working from animal anatomy and extrapolating, sometimes incorrectly, onto human bodies. Some of his conclusions were simply wrong, but because his authority was so absolute, and because human dissection would remain taboo across much of Europe for over a millennium, those errors were copied, taught, and accepted as fact for over 1,000 years. The gladiator's doctor had, without meaning to, frozen an entire branch of human knowledge in place. And as Rome's empire began to crumble, and Europe descended into what would later be called the Dark Ages, it would not be in Western Europe that surgical knowledge continued to advance. It would be in the Islamic world. While Western Europe's access to classical medical knowledge fragmented following Rome's collapse, scholars across the Islamic world were doing something remarkable, preserving it, translating it, questioning it, and building on it. Baghdad, Cairo, Cordoba, and Damascus became centers of medical learning, where physicians didn't just copy ancient Greek and Roman texts. They tested them, corrected their errors, and expanded on their techniques using direct clinical observation. The towering figure of this era is a physician named Abu al-Qasim al-Zahrawi, known in the West by the Latinized name Albucasis, who lived in 10th century Cordoba, in what is now Spain. Al-Zahrawi is often called the father of modern surgery, and the reasons why become obvious the moment you examine his work. His medical encyclopedia, known as al-Tasrif, ran to 30 volumes, and its final section, dedicated entirely to surgery, is illustrated with over 200 surgical instruments, many of which he personally designed or refined, including forceps, scalpels, bone saws, and cauterization tools, some bearing an uncanny resemblance to instruments still used in operating rooms today. Al-Zahrawi described procedures for removing bladder stones, performing tracheotomies, treating skull fractures, cauterizing wounds, and even conducting early forms of cosmetic surgery. He documented ligating blood vessels to control bleeding during amputation, a technique that would later be reintroduced to Europe centuries afterward, as though rediscovered, when in truth it had simply been forgotten there and preserved elsewhere. He wrote with unusual honesty about his failures as well as his successes, describing complications and mistakes so that other physicians could learn from them rather than repeat them. An approach to medical transparency that feels remarkably modern. Al-Tasrif was eventually translated into Latin and became one of the most influential surgical textbooks in medieval Europe, used in medical schools for over 500 years. When European surgery finally began to advance again during the medieval period, it was, in large part, standing on the shoulders of scholars like al-Zahrawi, even if his name was rarely credited by the physicians who used his work. Back in Europe itself, meanwhile, surgery was undergoing a strange and dramatic transformation, one that would place the scalpel in the hands of a profession you would never expect. By the medieval period in Europe, a strange divide had opened in the practice of medicine. University-trained physicians who studied Latin texts and diagnosed illness through theory considered surgery beneath them, too physical, too bloody, too closely associated with manual labor. Into that gap stepped an unlikely profession: the barber. Barbers already owned sharp blades and steady hands, the essential tools for cutting hair and shaving beards. It was a small, grim step from there to also pulling teeth, lancing boils, setting bones, and yes, performing amputations. By the 12th and 13th centuries, barber surgeons had become the primary providers of surgical care across much of Europe, operating not in hospitals, but in shops marked by a red and white striped pole, red for blood, white for the bandages, a symbol some barbershops still display today, centuries after its original meaning was forgotten by most who pass it. Surgery during this era remained a horrifying gamble. There was no anesthesia beyond alcohol, opium in small and inconsistent doses, or in the most desperate cases simply being struck unconscious. There was no understanding of infection. Speed was everything, not for comfort, but for survival, since a faster amputation meant less blood loss and less time for the patient to die of shock on the table. War, once again, forced innovation. Battlefield surgeons developed increasingly refined amputation techniques and the introduction of gunpowder weapons in the late medieval and early Renaissance periods created a horrifying new category of wound that existing medical knowledge simply hadn't prepared anyone for. It would take one French battlefield surgeon working with almost nothing to change the field forever. In the mid-16th century, a French military surgeon named Ambroise Paré was treating gunshot wounds using the standard method of the time, pouring boiling oil directly into the wound, based on the mistaken but widely accepted belief that gunpowder itself was poisonous and needed to be cauterized out. Then, during one battle, Paré ran out of oil. Desperate, he improvised a gentler mixture of egg yolk, rose oil, and turpentine, applied it to the remaining wounded soldiers, and prepared for the worst, expecting they would suffer far more than the men treated with boiling oil. The next morning, he found something that would change the course of surgical history. The soldiers treated with his makeshift, far gentler mixture were resting comfortably, their wounds beginning to heal. The soldiers treated with boiling oil, the traditional method, were in agony, their wounds inflamed and worsening. Paré had discovered, purely by accident, that the standard treatment had been actively harming patients for decades, and that a gentler approach produced dramatically better outcomes. He never treated a wound with boiling oil again, and he spent the rest of his career documenting and sharing what he had learned. Paré also revived and refined the ancient technique of ligating blood vessels during amputation, the same method described centuries earlier by al-Zahrawi, tying off arteries with thread to control bleeding instead of relying purely on cauterization. It was safer, more humane, and dramatically improved survival rates. He would go on to design prosthetic limbs for amputee soldiers, develop new obstetric techniques to safely turn a breech baby during difficult childbirth, and famously wrote of his own philosophy of medicine with a humility rare for a man of his skill. "I treated him, God healed him," a phrase that would echo through medical history as a statement of both confidence and humility. Paré proved something that surgery desperately needed proving. That tradition was not the same as truth, that the way things had always been done was not necessarily the way they should be done. That surgery, to truly advance, needed to keep observing, keep questioning, and keep changing. But even with Paré's innovations, even with centuries of accumulated anatomical knowledge from Vesalius and other Renaissance anatomists, who were, at the very same time, finally correcting Galen's centuries-old errors through careful human dissection, surgery in the 18th and early 19th centuries remained an act of raw terror. Patients were held down, or drunk, or simply screamed through the procedure fully conscious. Surgeons were praised for speed above all else, because speed was the only mercy available. Something was still missing. Two things, in fact. And when they finally arrived, within a few decades of each other, they would transform surgery more dramatically than anything in the previous 7,000 years combined. On October 16, 1846, in an operating theater at Massachusetts General Hospital, a dentist named William Morton administered ether to a patient before a surgeon removed a tumor from his neck. The patient, fully unconscious, felt nothing. Word spread almost instantly. Within months, ether anesthesia was being used in hospitals across America and Europe. For the first time in the entire history of surgery, going back to that Stone Age man on the cold earth with a stone blade pressed to his skull, a patient could undergo an operation without feeling it happen. Pain. The single greatest barrier to surgical advancement, the reason speed had always mattered more than precision, had finally been solved. But there was still a killer hiding in plain sight. One that anesthesia alone couldn't stop. Patients were surviving operations only to die days later from raging infections that surgeons couldn't explain. Hospitals themselves seemed to make people sicker. A phenomenon so consistent it had earned its own grim nickname among the public: hospitalism. In the 1860s, a British surgeon named Joseph Lister became convinced by the emerging germ theory of disease, pioneered by Louis Pasteur, that these infections were being caused by invisible living organisms, not bad air or divine punishment, as many still believe. Lister began sterilizing surgical instruments, dressings, and even the air in the operating theater using carbolic acid. The results were staggering. Infection rates and surgical mortality plummeted. Lister had, essentially, closed the final gap between surviving surgery and surviving what came after it. Between anesthesia and antisepsis, surgery transformed within a single generation from a desperate, agonizing, high-mortality last resort into something approaching the safe, precise, and deliberate discipline we recognize today. Everything that followed – sterile operating rooms, imaging technology, organ transplants, robotic surgery, minimally invasive procedures performed through incisions smaller than a fingernail – all of it was built on this foundation. Pain conquered. Infection understood. A 7,000-year problem, finally, mostly solved. Think back to where this story began. A man on the cold earth, a stone blade, and no promise of survival beyond the courage of the person holding it. From that single act, humanity built something extraordinary. Egyptian physicians who documented wounds with clinical honesty, an Indian surgeon who rebuilt faces the world had tried to disfigure, Greek philosophers who insisted medicine answer to reason, not superstition. A gladiator's doctor, whose knowledge, flawed as it was, shaped 1,000 years of learning. Scholars in the Islamic world, who preserved and perfected what Europe had let fall into darkness. A barber with a steady hand. A battlefield surgeon who ran out of oil and changed medicine forever. And finally, two discoveries, decades apart, that solved pain and infection. The two demons that had haunted every surgery since the very first one. Every operation performed today, every life saved on a table under bright lights, carries the weight of that entire journey. The scalpel a modern surgeon holds is, in a very real sense, the descendant of a sharpened stone. And somewhere, in a museum case or an archive drawer, that original skull still exists. The one with the smooth, healed edges. Proof that even at the very beginning, with nothing but flint and desperate hope, we chose to fight for each other's survival. History never truly disappears. It just waits to be uncovered. If this journey through the history of surgery fascinated you, make sure you're subscribed, because there are far more stories like this one still waiting to be told. And I want to hear from you. What moment in medical history should we explore next? Leave it in the comments, because the next story this channel tells might be the one you asked for.